And so what happens? They inflate and deflate. And so if someone is very full-breasted to begin with, then they might just need something like a lift, or maybe even a reduction, and perk them up and tighten them up, which doesn't require an implant. You don't have to add anything. However, many women that lose volume, then they deflate, and then they need something. So that's where we talk about an implant and a lift. So that's an augmentation mastopexy, or implant plus lift.
Double benefit.
Double benefit. And
possibly
then,
a double D.
There you go. Possibly a double D or C, or even more. And then for the abdomen, there are a range of procedures that start with liposuction, just to try to take care of areas of fat that seem to rearrange themselves, stubborn areas of fat, diet resistant. And then once you get beyond liposuction, if the skin is loose, or if the muscles stretch a little bit too much, which happens with natural pregnancy and don't come back together, then some form of a cutting and sewing tummy tuck type procedure, either mini, which works below the belly button, or full, which goes all the way up above, all the way up to the rib cage.
So the rib cage below is the full.
That's a full.
Do you also do that surgery? I think it's called, is it the diastin?
So it's either diastasis or diastasis. Yes.
Splits.
I say, so what it is the rectus muscles, which go up and down, the sit-up muscles. When you have a pregnancy, they have to spread apart a little bit to accommodate the child. I mean, it's just the way it is. The skin stretches, the tissue stretches, the muscles separate. They don't tear, they just separate, and then the pelvis changes. And then what happens is after pregnancy, all those things kind of shrink down. Some women it happens sooner than others. It seems like nursing seems to help it happen sooner.
Oh, so it helps the shrinking?
It does, yes. And then there are some women that'll wear like a waist trainer, a binder, a girdle.
Grandma called it a girdle. Always put your girdle on after you had a
Well, there you go.
Baby.
And actually, the thing that's good about girdles is that when I have patients that I do surgery on, I encourage them to use that compression after surgery to cut down on pain, cut down swelling, and to help shape, and so they don't mind wearing it. Whereas some women that are not used to wearing those kind of things say, I don't want to wear that thing. Can I get rid of it? It can be not comfortable, especially in the warmer weather.
Or when you're sleeping at night. I mean,
I like for the first couple of weeks to keep it on, even at night.
I think, you know what, I think it's wise advice. I had a sister-in-law who had twins, and she wasn't told, like, the OBs don't really tell you to do it.
No, not necessarily, right.
But somehow she did know she was supposed to, but she didn't, and she just never went back to anything remotely
normal. Did she end up doing anything? Did she visit a plastic surgeon?
I think she might be thinking about it.
Okay, good. Well, we might know a good plastic surgeon.
You might know one.
And then, that's it. So then the abdomen, so the abdominal, the tummy tuck is a bigger surgery, bigger scar, bigger recovery. Breast surgery can be like a week or two recovery. But if they're combined, then the limiting factor is how long it takes to recover from the abdomen.
So you do two procedures?
We would do both at the same time for a patient that's healthy, at a good weight, and understands what they're getting into, because it definitely is much more to recover for the abdomen than for the breast. But if they could have just lipo, if there's someone or just a mini, then it's a little bit easier. The incision's a little smaller, and the recovery's a little quicker than a full.
And with the lipo, I think some people kind of have the misconception that they can come in and, just suck all my fat away if I have 50, 60, 100 pounds to lose. How does that work?
I think you've heard about this before. How about everyone has that conception? I want a quick fix, a makeover, yes. The truth is that there are definitely limits to how much fat you can remove, because when you remove the fat, there's some blood coming out, so you could cause someone to need a transfusion. So generally the limits are about 3 to 4 liters, or a little more than 3 to 4 quarts of fat, and that's about all you'd want to remove in one session to be safe. You could remove more.
How much is that? How much is
well, think about like a liter. Let's see, a big bottle of soda is like a 2 liter bottle of soda. Yeah,
you
so
said
it's like
3/4 of a liter. Is that what I heard you say?
No, 3 or 4 liters.
Oh, 3
so
or 4
it'd be like 1 or maybe even 2 of those big ones. That's a pretty good amount.
Yeah, it is.
Yeah, and the point about that is that in order to make that successful, in order for that to be successful, the skin has to be of a good quality. So if it's a woman that's had pregnancies, multiple pregnancies, or even just sometimes one pregnancy, one big pregnancy,
she could be stretched
and stretch marks, loose skin, they may not even have that much fat. We always do some sculpting of fat around the back, so-called 360, the love handles. So even if the front doesn't have that much fat, we always do a little, if it's necessary, a little bit on the back, and then there's the cutting and sewing in the front, and then a little bit of liposuction in the front too, to help the contour that we've improved by removing skin and pulling down. So But but clearly, I mean, there are limits to how much. Everyone always says they can't just suck everything out, and then what happens is you can create skin irregularities and deformities and dimpling, and so you have to be careful.
Worse problems.
Oh, of course. Yeah.
And the other thing is, like you said, it's really hard to tighten skin without, because you have to do a lot of cutting and
That's
sewing
exactly
to tighten,
right. So skin
Scars.
tightening. Well, we'll talk about skin tightening. That would be a really good topic. That would take a while, but
Yeah.
there are minimally invasive procedures that can be helpful to tighten the skin a little bit, and it's a big thing now that people hear about. I want to get that treatment where you don't have to have surgery. Well, they're not as successful as doing surgery. So if you have a very, very minimal amount of loose skin, what could you do? Radio frequency skin tightening.
So you like that one?
Micro needling and radio frequency. Some types of laser treatment. Basically, you need to heat up the skin a little bit to get the collagen to turn over and to get the skin to tighten. For me as a surgeon, they're such mild effects that I don't really do them that much, but we do offer it for some people. And
Who
then,
have minimal.
yeah, I have a
problems.
minimal amount of problems. Or I've done the tummy tuck, and then there's one little area that still needs a little bit of work. Then you could do that. But to accomplish a whole, as much as you can accomplish a dramatic change with a tummy tuck, you cannot accomplish it non-surgically. So that's it. Despite what you hear from. No, then there's another thing like cool sculpting. Okay, so cool sculpting is freezing fat.
Do you
You've
do
heard about
that?
I do not.
Okay.
I don't perform that because I think also it's another mild thing. I do
Yeah.
have colleagues that are plastic surgeons that have it because they know that some people are just going to say, I want to try that. But you just hear about people that fail that because they're doing it for everything. If you do it for the very, very select patient that has a little something here and there, they may get a good result, but it's not to replace a tummy tuck.
Exactly. Well, when we come back, we're going to talk more about the mommy makeover.
Okay, sounds good.
But we're going to come back after this short commercial break and continue with Dr. Levens.